Good afternoon, everyone, and welcome to our Peace Health webinar today on concussion, 5 facts to know about this brain injury. The information that we present today is general in nature and does not replace the advice for your own personal healthcare provider. In fact, we do encourage you to talk with your doctor if you have any questions related to your health conditions or your diet. And it is my pleasure to be here with you today. My name is Summer Meyer. I'll be your moderator. Before I introduce our guest speaker, I want to remind everyone that Peace Health is ready to help when you need us. Many of our doctors do offer video visit appointments. So if you haven't already done so, please set up your My Peace Health account so you can make appointments, you can track vaccinations, receive your test results, and also manage your prescriptions there. If you already do have a My Peace Health account, you can log in and just make sure that your contact information is kept up to date. And with that, I want to invite you to engage with us today in our webinar by voting in our polls, asking questions in the chat, and also taking our survey at the very end. So now with that housekeeping out of the way, it's my pleasure to introduce our guest speaker, Dr. Kelsy Parker. Dr. Parker practices physical medicine and rehabilitation and sports medicine in Vancouver, Washington at Peace Health Southwest Medical Center and also our Salmon Creek location. Dr. Parker attended medical school at Creighton University in Omaha, Nebraska, and then went on to complete a physical medicine and rehabilitation residency program at the University of Washington. And she also completed a sports medicine fellowship at Mercy Health Center in Janesville, Wisconsin. As a former collegiate athlete herself, she is very passionate about the prevention and treatment of sports injuries with a special interest in concussions. When she's not at work, you can find Dr. Parker spending time outside with her husband and 4 very active and energetic kiddos. She also likes to run, travel, volunteer with young athletes, and cheer on the Portland Pilots men's basketball team. So welcome, Dr. Parker. Thank you so much for being with us here today. Let me pass it over to you now, and feel free to give our audience an overview of what to expect during today's session.
Thank you, Summer, and thank you to everyone for joining in from home to learn more about concussions today. It's a privilege to be here today with you talking about a topic that is really near and dear to my heart. So let's start by taking a look at the 5 different facts that we'll focus on during today's talk. We will address how concussions can happen to anyone, take a look at what a concussion is and how it commonly presents, discuss the importance of getting early treatment to optimize recovery, the different treatment options and different specialties used to help with recovery, and the importance of avoiding repeat injuries, especially when you are still recovering from the original injury. Now that we have an overview of all the different topics during today's discussion, let's delve a little bit deeper into our first topic, that concussions can happen to anyone at any time. Briefly, before we get into who is getting concussions, I just want to clarify some of the terminology that can be used, since there are many different ways to describe concussions. Did you know that all concussions are actually a form of a mild traumatic brain injury? Both terms can be used interchangeably, so throughout this talk, I might say both concussion and mild traumatic brain injury, or one right after the other. I think it is important to note this because previously concussions were not always thought as brain injuries, but they are now seen as one and the same, and so are often called both. So now that we have discussed the different terms, I think let's talk a little bit about who is at risk for these injuries. And I'll give you a hint, it's everyone. So some people think that concussions are a problem mainly for athletes, but more than 80% of concussions are not related to organized sports. And this is even in the pediatric population who do play more organized sports. From this percentage, it's pretty clear that concussions in athletes are not a majority of the brain injuries that are occurring every year. The most common causes of concussion are actually falls, motor vehicle collisions, and other traumas like violence, assaults, or other kinds of accidents. More than half the people who sustain a concussion are between the ages of 15 to 34, so not a lot of other medical conditions. And males are 2 to 3 times more likely than females to get a mild traumatic brain injury. As you can tell from these statistics, anyone can be at risk at an injury, and thus a person can be at risk of having a mild traumatic brain injury or concussion at any time. So if these injuries can happen to anyone at any time, knowing what a concussion is and how people behave when they have a concussion becomes so important. Before we switch to that topic, though, I'm going to hand over the presentation back to Summer, and we're going to take a poll to give us an idea about what your guys' experience are with concussions or mild traumatic brain injury.
Thank you, Dr. Parker. So I'm going to go ahead and invite you to take our poll. You'll see it launch in just 1 second here. Okay, so it should be open now. So we would love to hear from you what your personal experience with concussion is. Is it firsthand? Maybe you've experienced it yourself or been diagnosed with a concussion. Maybe it's secondhand, somebody that you know, or maybe your child has been diagnosed with a concussion, or maybe it's none at all and you're just curious, or if it's something else entirely, feel free to type it in the chat and share that with the group. Looks like we have about 80% of people who have voted so far, so get your final answers in, and I'll just close the poll in a couple more seconds here. All right, going once, twice, 3 times. Okay, so let me close this up and I'll share out the results with the group. You should be able to see those on your screen now. How's our audience looking today as far as experience with concussions, Dr. Parker?
Well, it looks like we got a good mix of people who have firsthand experience, mostly secondhand experience, so hopefully this can also provide some more information, and then people who don't have much experience at all. So we've got a little bit of everything. And I think that's helpful in how we're going to kind of talk about the different topics, but let's transition back to our next fact, which is the importance of being able to spot whether or not a person has a concussion. This is very important, not only because it can happen to anyone at any time, but also because people will present in many different ways following a concussion. Knowing a little bit more about what a concussion is should also hopefully help to explain why people can present so differently with many different signs and symptoms. To understand what a concussion is, there has been an international panel that has developed what a concussion is over the past 10 to 15 years. This definition continues to be reevaluated every couple years by this expert panel to make sure that it encompasses all that we know a concussion is, taking into account all the most recent research and other findings. Okay, so what is a concussion? In order to have a concussion, obviously you need to have an injury to the brain. This can occur either with a direct blow to the head, which most people commonly think of, but it also can occur with an indirect blow where there's this force of energy that's transmitted through the body, which then in turn affects the brain. So for example, a person might fall from a 2-story building, and even if they don't actually hit their head, the force of the fall can still cause an injury to the brain. Also consider someone who's been in a motor vehicle collision, where the head is, again, not directly hit by anything, but you have this motion of the neck going from flexion to extension and sometimes even back into flexion that can cause an injury to the brain. So it's important to know that you can have a direct injury or an indirect injury. After this injury, the person will develop signs and symptoms where they are not acting like their normal selves. This signifies a disturbance of the brain function. The reason for this brain dysfunction is a very complex pathophysiologic process. Now you might say, what does that mean? It essentially means that the injury affects the nerves and the energy processes of the brain cells. It is a functional injury, which means there's no actual damage to the structure of the brain that we can pick up on imaging, but it is thought that there is a stretching of the nerves, A disruption of the nervous system, especially the autonomic nervous system, which really helps to control the fight or flight reflex and the rest and digest reflex. And then this creates a mismatch between the blood flow in the brain and the energy the brain needs to function normally. I will try to simplify this using an analogy I often use in my clinic during the next slide, but there is just one more criteria that needs to be met in order for a person to be diagnosed with a concussion. The final criteria is that the signs and symptoms cannot be otherwise explained by a different medical process. And some of them are listed there, but for example, someone can't be on mind-altering substances causing the symptoms, medications. They shouldn't have another injury that could be creating the same symptoms, like a neck injury, or other medical conditions like someone having a primary headache disorder that could be causing the symptoms. If a person meets all of these criteria, then they are thought to have a concussion or a mild traumatic brain injury. Now, if it seems like the definition of a concussion is somewhat complex, this is because a concussion itself is very complex. So in order to try to simplify what a concussion is, I typically use an analogy of your brain being like a garden. The brain can do a lot of different functions, just like a garden can grow a lot of different plants. But it needs to have the right balance of energy supply and blood flow, just like a garden needs to have the right balance of sun and water. When there is an injury to other parts of the body, not the brain, the response for healing is to have swelling in the injured area. That swelling actually brings growth and healing factors to the injured area. Unfortunately, when there is an injury in the brain, it cannot have swelling because in the brain, swelling can lead to very bad outcomes, including death. So when there is an injury to the brain, there is this subtle decrease in blood flow to the injured area to avoid any swelling. In the garden, this would be like kinking the garden hose to decrease the flow of water to the plants. With less water, it becomes more difficult to water all the plants at the same time, like it is difficult to continue to do all of the brain functions that were done previously without difficulty before the injury. This creates a mismatch between the energy needed for the brain to heal and function normally and the decreased blood flow to the injured area. This imbalance is what we currently think causes the symptoms of a concussion. Simple tasks require less energy to do, whereas complicated tasks require more energy. This is why complicated tasks like problem solving and multitasking tend to cause more symptoms for longer periods of time in people with brain injuries compared to simple tasks such as getting dressed. As the brain heals, this mismatch between the energy and blood flow improves as the hose unkinks or the blood flow to the brain normalizes, so the person is no longer having the symptoms they had with the brain injury. Now, everyone's metaphorical hose unkinks at different times, just like everyone's symptoms improve at different times. I hope this can somewhat explain how a concussion or mild traumatic brain injury affects the brain function and why certain activities cause symptoms more commonly compared to other activities. So now that we've discussed what a concussion is, I think it's important to discuss the common signs of a concussion. Knowing these signs can help diagnose a person with a concussion, even if they don't realize they have one right away. Signs of a concussion are actually things that other people observe. For example, the family, friends, and coaches of a person might notice changes in their behavior before they do. Some of the most common types of signs that we associate with a mild traumatic brain injury include abnormal balance and coordination, poor concentration, changes in speech, delayed responses to questions, vacant staring, disorientation, and difficulty answering simple questions like what day it is today, disturbances in sleep, and even unusual emotions for the person, such as sudden outbursts of anger or crying that seem to be out of the norm for them. In addition to the signs of a concussion, it is very important to also know about the symptoms of concussion. The symptoms are what the person with the injury experiences themselves. This is also important to evaluate regularly because it is the symptoms that we follow for improvement of a concussion and the symptoms that help guide the management plan as we move forward. As you can see, there are many different types of symptoms, including headaches, vision changes, sensitivity to light and sounds, dizziness, balance abnormalities, fatigue, difficulty thinking clearly, getting confused easily, decreased concentration and focus, feeling slowed down, difficulty learning new information, increased emotions like sadness, irritability, anxiety, or even anger, and difficulty sleeping or insomnia. Oftentimes when you see a provider in the clinic, they may ask you to fill out a form that looks like this. This form is used to diagnose concussions, especially in the sports arena. It is a mostly validated tool to use at the sidelines when someone initially gets a concussion, but I often use it in clinic to gauge how the person is recovering with treatments. So you might not be able to see, but this is a form that tracks 22 different types of symptoms from the range of no symptoms or a score of 0 to very severe symptoms or high symptoms with a score of 6. Again, this is a good way just to monitor and focus the treatment plan so that it is symptom specific, which is important as we get treatment underway early, since early treatment has been shown to improve a person's recovery. So after taking some time to discuss what a concussion is and the most common signs and symptoms, I want to briefly discuss what a concussion is not. This is important because if you notice some of these things happening, it would be necessary to discuss with a medical provider, since it might be concerning for something else going on above and beyond a brain injury. So a concussion should never present with progressive, ongoing worsening of symptoms, especially after the 72-hour window where we kind of have this rest period. The symptoms might worsen if you do too much activity, physical activity, or mental activity, but those symptoms should always improve with rest. If there is this progressive worsening of symptoms, then this needs to be further evaluated. A concussion is also not an injury that you can see on imaging based on our current technology. If there is an injury that can be seen on the MRI or CT scan, then it is either more of a moderate or severe brain injury, which has a different kind of prognosis, or it is some other type of medical injury. By definition, a concussion would have normal imaging, at least at this point with the type of imaging that we have available to us. A concussion is also not a one-size-fits-all injury. Each person and even each injury is unique and requires a unique treatment approach for optimal recovery. This becomes very important during our next topic when we discuss the different treatment plans. Finally, a concussion is not a minor injury that a person can just push through or tough it out. This mentality can actually lead to longer recovery times from a concussion and lead to worsening outcomes. This is a very serious injury and should be taken seriously. I do feel like this is a really important topic to reiterate and emphasize over and over again. So I included this slide to show that even though we call it a mild traumatic brain injury, it doesn't mean that it causes mild symptoms or mild impairment or mild disability. While most people do recover completely after a concussion or mild traumatic brain injury, sometimes the injury can lead to permanent or persisting symptoms that never completely go away. This is important, especially for people who are personally dealing with more prolonged or challenging recoveries, and even their family and friends who will have to be there to support them, since it will and can significantly affect a person's life. Finally, while discussing what a concussion is and is not, it's also important to know the red flags associated with a brain injury, so that if a person develops any of these symptoms, they will know to seek medical attention immediately, most often in an emergency department. These symptoms will typically present on the day of injury and include things like neck pain and tenderness, or any weakness or tingling in the arms and legs, as this could be concerning for a neck or a spinal cord injury. Double vision could be concerning for an eye injury or swelling in the brain, and severe or increasing headaches, seizures or convulsions, loss of consciousness, deteriorating consciousness, vomiting, especially more than twice in one day, or increasing restlessness, agitation, or combative behavior should be assessed, since this could be concerning for increased swelling or bleeding in the brain. If any of these develop in a person who has had an injury to the brain, they should not delay evaluation by a medical provider. However, if a person doesn't develop these symptoms on the same day after a mild traumatic brain injury, then most people don't need to be seen by a medical provider immediately, or at least not on the same day. So there's no need to rush off to urgent care necessarily. However, it is recommended that a person who sustains a brain injury should be evaluated within the first 3 days to a week after the injury to start an early treatment plan. On that note, I will hand the presentation back over to Summer, who will take a poll to gauge what you think might be the best initial treatment option following a concussion.
Thank you, Dr. Parker. I also just want to say, while I get this poll launched, it's so fascinating to me, the comments about the signs versus the symptoms, signs being what is observed, symptoms being really the felt experience of the person. And I also really love your metaphor about the garden hose and the kink in the decreased blood flow. That's really helping my brain understand. So let's move into the poll. I'm going to launch it for everyone here, get it started. You should see it now. We're curious what attendees today in this meeting think the best treatment for concussion is. Do you all think that it is bed rest, meaning no activity or no electronics? Or is it no changes in behavior? In other words, relative rest? Or maybe it's option C. Is it no sleeping, wake up every 2 hours? Or have you heard of a different treatment for concussion that you think might be better? If so, feel free to type that for us in the chat. And let me just give you another few seconds here. It looks like we've got 50% who've participated so far, but that number is climbing. So let's see if anybody has typed in anything in other. Not just yet. Okay, so I'm going to go ahead and close the poll. It looks like we're almost at 100%. And then let's share out these responses to see what this group thinks. Dr. Parker, I'll hand it over to you. Any comments about the results here from attendees?
Well, I think hopefully we'll learn a little bit more about the best treatment option, because most of you responded with bed rest, which used to be the most common treatment, but is not anymore the recommended first initial treatment. So,
yay, we get to learn something new. Okay, this is great. Let me hide the poll and then I'll transition back to sharing these slides.
All right. Well, I do think that is a great starting point as we start to explore the importance of getting early treatment. Since we are seeing a lot more research and literature showing that early interventions in the treatment of concussions actually leads to better outcomes. So this next slide just shows a bunch of different research articles showing lots of different thoughts behind the treatment plan. And it is very important to note that the treatment of concussions is changing regularly. It has been changing over the past 10 to 15 years. And so it's kind of important to try to keep up and see what's different and what's the best treatment plan. We'll discuss briefly some of the older previous treatments used after a concussion or a brain injury as a way to emphasize what we are no longer recommending. But there has been this large paradigm shift in the treatment of concussions, mostly due to the research studies on this topic. Above, like I said, are just a few of those research articles. There continues to be a lot of research being done to optimize recovery from these injuries and even trying to prevent these injuries. So I suspect the treatment options might continue to shift as we learn more about these injuries. So Our current mainstays of treatment are listed here for you. Now, relative rest is the first initial treatment. It's very important in a mild traumatic brain injury, especially in the first 24 to 72 hours following an injury. I'll discuss relative rest a little bit more on an additional slide, but to be clear, this is not complete rest. This is not bed rest. We are no longer recommending that since it seemed to actually worsen outcomes in people with brain injuries. After a period of relative rest, evaluation by a medical provider, usually preferably within a week after the injury, is important as it ensures that an early individualized symptom-based treatment plan can get started. So really the treatment is based on the person's symptoms. As the complexity of concussions has continued to evolve, the importance of having an interdisciplinary or multiple specialists involved has become the mainstay of a really good treatment plan. This allows a focus on specific treatments that will help a person optimize their recovery based on their individual concussion symptoms. Finally, in recent years, there has been growing evidence supporting the importance of low-level aerobic exercise, which doesn't worsen the symptoms, in the treatment of concussions. People who exercise early on without worsening symptoms seem to recover from the symptoms faster than people who do not do any aerobic exercise. Again, I'll discuss this a little bit more in detail in a couple of slides, but before I do that, I would just like to emphasize that this list is really a very simplified version of how we treat concussions. There was a position statement put out by the American Medical Society of Sports Medicine in January of 2019, which included a diagram that I think better represents the process behind treatment of a concussion. And so, as you can see in the next slide, this is a very complicated diagram, and it's probably difficult to kind of make sense of at this point, but it includes all the different treatment options for the common symptoms that present following a traumatic brain injury. Obviously, there's a lot of overlap between symptoms and how we treat. And again, this is why it's important to have a diverse group of specialists involved in the treatment plan, because as you can see, it's not as simple as a list of ways that we treat. It is more of this kind of integrated approach where we need lots of different people with doing their specialties and their strengths as a person recovers. So a little bit more about relative rest, because it is very important, especially initially. This is one of the major areas of change in the treatment of mild traumatic brain injuries. So I felt it was important to discuss a little further and clarify what exactly is relative rest. Relative rest is having a person do their normal daily routine at home while limiting activities that worsen symptoms. The goal is to minimize energy used by the brain. So essentially trying to do some mental rest and some physical rest while still performing self-care activities, still getting up and doing your normal routine. If an activity that you do worsens the symptoms, for example, a common one is reading or watching a screen, then you stop that activity. But if that activity is not worsening your symptoms, then you don't necessarily have to stop doing it. Activity can slowly be increased as long as it is below the symptom exacerbation threshold, so as long as it's not making your symptoms worse. I typically tell my patients to listen to their bodies and rest when needed. Relative rest is not going into a dark room and turning off all the lights. It is not cocoon therapy, which is what they used to recommend as well. It is not waking up a person every 2 to 4 hours to make sure that they are still waking up. It is not strict rest with no interactions, and it is not too much activities like trying to go for a run or weightlifting or going to sporting events. We don't really even want you to do much aerobic exercise within the first 24 to 72 hours. We want you to wait after those first 3 days before doing any increased physical activity. Doing too much activity or doing too little activity can actually cause the symptoms of a traumatic brain injury or concussion to be more prolonged and can worsen someone's time to recovery. With this in mind, After the initial rest period of that 24 to 72 hours, there has been a lot of increasing support for the importance of starting low levels of exercise, even if a person continues to have symptoms of the brain injury. Previously, it was believed that a person had to wait until all of their symptoms were gone and they had to be symptom-free before they started to exercise. But again, there has been a shift in this thought based on the research that's been done with concussions and brain injuries. Research has actually shown that low levels of aerobic exercise as early as 3 days after concussion is not only safe, but it can actually help prevent prolonged symptoms as long as the exercise doesn't worsen a person's symptoms. So if my headache before I start is at a 3, then it shouldn't jump up to a 5. That's worsening the symptoms. It should stay at a 3. The reasons exercise likely help are due to multiple factors, especially helping to regulate and balance the nervous system. As we discussed before, when we talked about concussions, there is that disruption of the nervous system. Well, exercise really helps to balance that out. So if we improve the nervous system balance, we might also be able to decrease the risk of those prolonged symptoms. Exercise is also known to help regulate the cerebral blood flow, which will be important after a brain injury, improves sleep, and improves mood, all of which are essential components when we're addressing the recovery of someone with a concussion. After multiple studies, there has been no worsening of outcomes with the addition of this type of exercise, and actually they were surprised to find that it was much more beneficial and did help decrease prolonged symptoms. The thing I really want to emphasize, and I've said it multiple times, is that it should not worsen symptoms. So it is called Now that we have discussed different types of treatments used to treat concussions, let's talk a little bit more about who is involved in the treatment of mild traumatic brain injuries or concussions. So I've reiterated this multiple times, but concussions are complex. They require a whole team of healthcare providers and specialties who specialize in different interventions that really provide the best outcomes for a person with an injury. Here are some of the most common providers and specialists that are typically involved in a comprehensive treatment plan for someone with a mild traumatic brain injury or concussion. There can be physical therapy, occupational therapy, speech therapy, vision therapy, or visual specialists like neuro-optometrists or neuro-ophthalmologists. Psychiatry, psychology, and neuropsychology kind of all get grouped together, and usually some kind of medical provider. I've listed most of the medical providers as different types of physicians that we have, but there can also be other type of providers like naturopathic doctors, chiropractors, athletic trainers, and anyone if they have the specialized training in concussions or brain injuries. Now, before I go a little bit more into the roles of each provider in the treatment of a brain injury, I wanted to briefly discuss, at least touch on some of the different subsets of concussions that can exist, at least in the literature, and some people might talk about, as most of these will have more specific treatment plans geared to them because those are your primary symptoms. Some of these subsets can be broken down into the following categories based on whether the person is having the most difficulty with mental activities or cognitive activities, if most of their symptoms are due to headaches, vestibular dysfunction like vertigo or dizziness, problems with controlling their moods and emotions, neck pain, or other vision abnormalities. This is a good way to kind of help break down what specialists might be most important to get involved early, depending on where the person's symptoms are most prevalent. But I would say that clinically, in my experience, a lot of people will present with multiple concerns in many different subsets of concussions. So it's good to be familiar with this terminology and that there are sometimes these subsets, but really it's focusing the treatment on what the patient is experiencing. And the different subsets, they don't seem to, if you break them down into that, it doesn't seem to predict recovery from an injury. So it really is just a way to kind of label what people are most experiencing. I will now move on to briefly discuss what the different specialists in treating mild traumatic brain injuries are and what their role is mostly in the treatment plan. So first, we'll talk about the role of physician or other medical providers. And really their goal is to help the person with the brain injury and the family members to navigate through the brain injury and be the main contact for coordination of care. They should address the need for medications to treat severe or persisting symptoms if this becomes necessary. Most often this is for things like sleep disturbances, headaches that are continuous and they're not getting better, and even mood disturbances, so PTSD, anxiety, and depression. Also, if there's a concern or a need for further imaging to rule out if there's any other possible pathology going on, causing some of the more prolonged symptoms, then the medical provider will most likely be the one to do the additional imaging. And sometimes that's of the brain, sometimes of the neck, depending on what your symptoms are. A lot of the visits are spent providing education and expectations about recovery, as well as addressing concerns with returning to school, sports, and work, whichever is most appropriate to the person with the injury. Common types of medical providers include primary care physicians, neurologists, psychiatrists, sports medicine providers who have done extra fellowship training, pediatricians, even some orthopedic and neurosurgeons can be concussion specialists, and then physical medicine and rehabilitation providers. Now briefly, the role of physical therapy really is to help focus on concerns with when people have problems with their balance or their vestibular system. So again, the vestibular system is not always common for people to know what it is, but it really is where the body is during movement. So a lot of people know what vertigo is, and that's a dysfunction of the vestibular system, but it is kind of that dizziness and feeling that you don't know where your body is when it's moving. They also will help focus on neck pain, or if you're having headaches that are thought to be from the neck. And they usually will be the person who helps return the person with a brain injury to either sports, exercise activities, or even other exercise programs as appropriate. So they help to guide them through this return to their previous level of exercise without worsening symptoms. Sometimes using something called the Buffalo treadmill test and monitoring heart rates to make sure that they're not making symptoms worse with exercise. Now, the role of an occupational therapist, especially for brain injuries, is really to work on sensory processing. After a brain injury, it just seems like everything is overstimulating to the body. And so they really help with working on tools to address that. They also really help if there's any issues with vision, working on visual processing, and even doing some vision therapy. The goal to working on maximizing function in things like reading and navigating different environments, which is a combination of all of those tools together. They also will help work on processing speed, a return to safe driving if this is necessary, and working on returning to multitasking functions, which again are more complex and often one of the later things to kind of return without symptoms. They also provide a lot of education about brain injuries, about processing, and even about sleep hygiene. The role of speech therapy, sometimes this is the most underappreciated maybe, or misunderstood kind of therapy. I would say a lot of people say I don't have a problem with my speech, but a speech therapist, they work in a large group of different treatment options. Speech is one, but also cognitive activity, which is primarily the focus that they use in brain injury. So the role of speech therapy is to focus more on the mental tasks necessary to get the brain to function where it was previously. So focusing on things like language, memory, attention, speed of processing, so that if someone's having a conversation with you, you can interact with them quickly, which sometimes is difficult after a brain injury. And then finally working on more of those executive functioning, which are managing the higher level tasks like planning, organizing, and again, multitasking. So they really help to focus on the cognitive issues that are related to a brain injury. The role of neurooptometry or neuroophthalmology is really to evaluate the way the eyes are moving and how they are processing visual stimulation. And their goal is to provide options like vision therapy to optimize the movement of the eyes. A lot of times after a brain injury, the eyes don't move symmetrically. And so it can be necessary to see a neurooptometrist or ophthalmologist to evaluate this and see how significant the dysfunction of the eye muscles are and whether or not they need more extensive visual therapy. Sometimes this happens in conjunction with occupational therapy, or sometimes they will wait until occupational therapy is done and then do a more in-depth vision therapy if able. They also can evaluate the need for specialized glasses. Most commonly are prisms. If you know someone who's had a brain injury, that typically prism glasses can help with someone with some abnormal eye movements and some processing issues. So they can help with headaches, the abnormal eye movement, and the sensory processing that typically can be affected after a concussion or a brain injury. The final group that we'll talk about is the psychologists and psychiatrists, which their involvement can be very multifaceted. But there has been a lot of new and emerging research showing that being treated after concussion with a form of cognitive behavioral therapy can really help decrease the risk of prolonged or persisting symptoms. Because of this, cognitive behavioral therapy might become more important in the future treatment of these injuries. It's not as common yet, just because sometimes there's difficulty with access to these providers, especially ones with training in brain injury. But as more research comes out showing whether or not this is beneficial, this might become more of a mainstay in treatment. In addition to doing that cognitive behavioral therapy, they are also treating some of the mood dysfunction that is very common with a brain injury. So they're working with things like the anxiety, depression, PTSD, and also I always talk about there's this adjustment to a mild brain injury and all the changes and challenges that accompany it. Because people usually are very high functioning, they're independent, and then they start to lose this with the brain injury. So a lot of times there's this grief of the way things used to be and this frustration. So a lot of that can be addressed with this, with psychologists or psychiatrists, this kind of adjustment to their injury. Also, I've had a lot of luck with psychologists really helping with sleep hygiene, and sleep is very important to the recovery of a brain injury. Occasionally, it is necessary to perform something called neuropsychological testing, which is a really long series of testing, usually takes 6 to 8 hours. And it's really to see why a patient might be struggling more and can help focus the treatment plan. But this is only done when symptoms are really persisting and we're feeling like we need a little additional information. Well, this is just a little tiny bit of information about what major roles some of the specialties and other providers play in the treatment plan of concussions. And sometimes people will have a lot of symptoms and will need to have the involvement of all of these specialists. But sometimes a person will only need to have 1 or 2 of them involved, especially if they're only having really persistent symptoms in 1 or 2 areas. The important thing is to try to get treatment as early as possible. Again, I'll reiterate those points over and over again because I think they are very important. All right, so we have finally reached our last point of discussion, which is to avoid the risk of re-injury as much as possible. This might seem like a no-brainer to people, like, duh, you want to decrease the risk of injury, but really subsequent injuries can affect the recovery process for a person. We will now focus on concerns for a person getting re-injured immediately after initial injury, so kind of that day of the injury, a repeat injury during the recovery of an old injury, and even some concerns for these long-term consequences for repeat injuries over a person's lifetime. So the first and probably the most serious one, because it can be life-threatening, is a recurrent injury the same day as an initial injury. So this is one of the major concerns, especially in the sports world. And the reason it is so important is because if a person has a second brain injury within especially that initial 24 hours after an initial injury, this can lead to something called second impact syndrome. When this happens, the brain loses the ability to regulate the swelling, and that's kind of what we talked about initially with a concussion, the importance of decreasing the risk of swelling. And so if you have the second injury, you lose the ability to regulate the swelling to the injured area, and this can lead to catastrophic pressure, permanent and severe symptoms, and even death. The second impact syndrome is the reason why I think that there is so much more awareness about concussion in sports, and for good reason, because young athletes were dying and it was a completely preventable death. So if the athletes had just sat out and not gone back in after having an initial injury, they wouldn't be at risk for the death. And so it was after athletes started dying that really people started to take a look and question, why are we letting this happen? The first law regarding not being able to return back to sport on the same day as an injury was passed in the state of Washington. And it is called the Lysted Law. And it was named after a high school football student who had a significant second impact syndrome. And he was fortunate enough to survive, but had significant permanent disability from it. And he actually, with his family, lobbied all the way up the state to get a law passed prohibiting people from returning on the same day of injury. And that kind of started the process of every single state putting into law similar kinds of restrictions. And now it's pretty universal. Based on the severity of consequences following a second injury on the same day, there have been lots and lots of protocols in place to avoid these injuries. And thus, you might have heard the slogan, when in doubt, sit it out. So that's kind of where this came from, because the risk of injury and the result of possible death is not worth going back in and playing the sport. Now that is a little bit less common in terms of most patient populations. Having a repeat injury the same day is not usually what people are at risk of, but people can also get recurrent injuries while they are still recovering from an injury, even if it's outside of that window for concern of a second impact syndrome. This is definitely more common in patients who have symptoms for longer periods of time, just increases the window. So if you have prolonged symptoms, you're at risk of having a second injury just because of the length of time it takes to recover. The concern with repeat injury is really that it starts to take longer for a patient's symptoms to recover. Meaning that they can take longer return to school and return to normal functions, longer to return to work and a normal routine. And this can create a lot of frustrations and potentially lead to worsening progress just because of feelings of setback and challenges with having symptoms for so long. It also can lead to additional symptoms after a second injury. So sometimes your dizziness or your vertigo can get worse after a second injury, or any of the symptoms that might have improved might start to come back. So it is important, and we always say that, avoid the activities that worsen symptoms and avoid increased risk of falls. And so these are really important so that you don't have these prolonged symptoms. It is important to know that even with repeat injuries, when you're continuing to heal from the symptoms, we still don't see any evidence of worsening brain function with these repeat injuries at this time. Doesn't mean that it's not happening, it's just that we don't have any evidence for it, and we don't have enough research to kind of say, yes, if you have a second injury while recovering, that you're actually doing more damage to the brain. We actually can't say that, we don't see that yet. And so that's something to continue to keep an eye out for, because they are trying to find more information about what's happening during these repeat injuries that make the symptoms go on for longer. All right, so the final topic, recurrent injuries. Briefly, I'll just discuss this, concerns about multiple concussions in a lifetime. Unfortunately, we do not know a lot about these long-term consequences, even with lots of research that's continuing to be done. What we do see is a trend that with repeat injuries or subsequent injuries, there are usually longer recovery times and smaller impacts that can lead to concussions. This can lead to a lot of frustrations and again, be a reason that people have to medically retire from sports or other activities that are high risk. There's a lot of media attention around chronic traumatic encephalopathy or CTE, and even subconcussive impacts are now a hot topic in people's conversations, especially around brain injuries. But unfortunately, we still don't know enough information about causes, why some people get clinical symptoms and others don't, or even how many hits or how hard of hits or any of that information, how long that might lead to long-term consequences. At this point, we are just continuing to have an honest discussion about the unknowns and potential risks with people who have had brain injuries or repeat injuries. Okay, well, we have spent a good amount of time talking through a lot of information related to concussions and mild traumatic brain injuries. Some of the major points that I think are important to take away from this talk are on this slide, including the importance of taking concussions seriously, knowing that concussions can happen to anyone at any time, recognizing the signs and symptoms of a concussion early so that a treatment plan can get started early and optimize recovery, knowing that treatment should be a multidisciplinary approach as the best way to focus on people's symptoms and optimize recovery, and finally, the importance of trying to avoid repeat injuries. Hopefully you found this talk informative and you feel that you have a better understanding about concussions and mild traumatic brain injuries. Now I'll hand off the presentation back to Summer for any questions or answers or comments that you'd like to share with us.
Thanks, Dr. Parker. Wow, that was incredible. Packed full of a lot of really super useful information for me and hopefully for our attendees as well. I'm going to stall just a few seconds here while people add their questions to the chat. We have a couple of minutes. We can do a Q&A with Dr. Parker while she's here. And while you're thinking about what you would like to ask, I do want to remind you a session will be posted, a recording of this session. And we will also post slides and handouts. We actually have the slides and handouts available for download in this webinar tool. So you can do that now, or you'll get a follow-up with a link to our webpage that contains this information. And so with that, let's go ahead and move into the Q&A. I'll just double check to see what questions have come in so far. Okay, we have one from Chris. Thinking of my active 7-year-old. If parents of children suspect a child has a concussion, which type of provider should we initially seek care? Perhaps a pediatrician? And also, how quickly should we expect the appointment?
That's a great question. So especially if it's an acute injury, I would say I would hope that you could get in within a week. A lot of times, especially pediatricians, they often deal with people with kids with injuries. And the difficult part is that every different area has different specialties that focus on concussion. So down here, we have our family medicine providers and our physiatrists. So what I am focusing on the concussion prevention or treatment, but in other places it might be a neurologist who really specializes it, and they have a pediatric neurologist up in Bellevue, I think at Peace Health, who is primarily doing concussions up there. So I think your pediatrician is a great resource to say, I'm worried my son has a concussion. I'd like to see someone specifically about that. And sometimes the pediatrician will want to evaluate them and they might have a good base. And if not, then doing just a little research in the area. A lot of times people will be able to tell you whether or not they commonly treat concussions or brain injuries. And I treat young kids. I think the youngest I've had is 6, but it depends on the provider. So sometimes it takes a little legwork about where you live to see who's your providers. But a lot of times you can find some of that stuff online or by asking other people who might have been in similar situations.
Yeah, that's great. Use your networking resources. We have some thank yous posted for your time today. I don't see any other questions. So feel free to post if you do have any. We have a couple minutes left here. And while the audience is thinking about posting, I am going to advance the next slide and just remind you that if you do want to stay connected with us and learn more, Peace Health has a monthly e-newsletter. It's chock full of health news, local events, and alerts about upcoming future webinars. So make sure that you sign up for our mailing list at peacehealth.org/healthyu/subscribe. And we do have some interesting topics in the works coming up around heart health that's coming soon. So definitely don't miss out on that. And then I do want to also remind you, as soon as you close your session here, you'll be prompted to take a short 3-question survey. We do look at every single piece of feedback so we can make sure to improve for the next time. And also just super curious what other topics that you'd like us to consider. And then with that, looks like there are no additional questions. So just a final thank you so much, Dr. Parker, for your time. Oh, we do have one comment. Thank you so much. My niece had a fall, and now I know that she should go see someone. Thank you, thank you, thank you. So that one was from Diane. So great, Diane. Thanks for sharing that with us. I'm so glad that we could be of help for you today. And just shout out again to Dr. Parker, spending your lunchtime with us instead of eating. I really appreciate it, and sharing all of your knowledge and expertise around concussions. I'm going to remember the phrase, when in doubt, sit it out, and that it's complicated, definitely. So this has been wonderful. Thank you again so much. So to everyone, until next time, stay healthy and be well.
Thank you.